Hello everyone. Today we are going to study about paranasal sinuses. So as you can see in this picture, we have four pairs of sinuses, two frontal sinuses. These are the frontal sinuses, and these two are present above above the level of the eyes on the base of the frontal bone, and two ethmoidal sinuses, and these two are present on the ethmoid bone, and two maxillary sinuses at the side of the nose, and two sphenoidal sinuses. These two are present behind the eyes. The frontal, maxillary, and the sphenoidal sinuses have single opening, but the ethmoidal sinus have a number of thin-walled cellular cavities. So in this picture, you can see a MRI report of sinuses. So sinuses are the hollow cavities inside our skull, interconnected hollow cavities inside the skull, and they are filled with air. So in MRI or in CT scan, we can see sinuses black. So the black structures are the sinuses. Maxillary sinus. They are located just above the level of first and second premolars and molars. And that is why if a patient is having sinusitis of their maxillary sinuses, means infection in their maxillary sinuses, the patient can also feel can also get toothache. And in these kind of cases, you cannot ask the patient to go for oral antibiotics because the cause is different over here. And these sinuses are pyramidal in shape. So now the frontal sinus. These sinuses they lie within the frontal bone, and they are triangular in shape, and they drain into the middle meatus of the nose via the infundibulum. And if someone gets infection in their frontal sinus, they will develop a frontal headache. Now the ethmoidal sinus, they are present as small cavities within the ethmoid bone, and if someone gets infection in ethmoidal sinus, then they can develop uh, dacrocystitis, means infection of the lacrimal gland. And the sphenoidal sinus, they are present at the base of the skull, within the body of the sphenoidal bone. And if there is any infection present in the sphenoidal sinus left untreated, then they can develop cranial neuropathies like meningitis and intracranial abscess. And one more function these paranasal sinuses they perform is that they prevent our brain and our facial features from infection. So what they does is they uh, contain mucus, as this is any lining of any paranasal sinuses. So the cells inside them they produce mucus, and these mucus they are sticky in nature. So what happen is if any microorganism, be it fungi or bacteria or any virus, if they get inside these linings of these sinuses, these mucus they the microbes they get stick into this mucus, and the lymphocytes they present inside this lining they engulf uh, that microbe and they kill them. And so now the functions of the paranasal sinuses, first, as they contain air, so they lighten the weight of our head, and they humidify the inhaled air that we inhale during our respiration, because the humid air is better for our health, as they prevent lung diseases like common and cold, etc. And they increase the resonance of our speech and provide protection to facial features. So this is how they prevent our body from infection. And now a question arises that what will happen if these paranasal sinuses they gets fractured? Um, I'm doing this lecture because I have seen many cases of sinusitis, as sinusitis is one of the most common disease of our respiratory system in the entire globe. But I have seen only one case of fractured paranasal sinus. Um, Recently, a 18-year-old boy he came to us, um, and he told us that he was driving his motorcycle with a very high speed, and he met with an accident, and he fell to the ground on his face, and he fractured his frontal sinus, and then after that he developed symptoms like fever and clear nasal discharge and altered consciousness, and also symptoms like hyposmia and anosmia. Hyposmia means decrease sense of smell, and anosmia means complete. There is no sense of smell at all. So symptoms like hyposmia and anosmia they develop because um, due to accumulation of blood, they block the uh, nasal passage, and or due to infection, development of infection in the sinus. So they block the nasal area, so they block the passage of the nose, and that is why there is symptoms like hyposmia and anosmia and clear nasal discharge. In fracture of any of the sinus, these symptoms are common. These symptoms will be commonly seen. So now, what is sinusitis? Sinusitis means there is infection in any of the paranasal sinuses, that is known as sinusitis. Inflammation of the tissue lining in the sinus, and it can be due to bacteria, virus, or fungi, and most commonly due to bacteria. And bacteria like Streptococcus pneumoniae, Haemophilus influenza, or Moraxella catarrhalis. And sinusitis due to fungi is very rare, because if any person is having very low immunity, then only a fungal sinusitis will develop. So now the pathology of the sinusitis, due to any reason that is developing the infection that will block the sinus passage, and due to this blockage there will be pressure feeling around the nose, eyes, and the forehead, because all the sinuses they are interconnected. So there will be pressure feeling around the nose, eyes, and the forehead, and nasal congestion and frontal headache. And one more symptom that is known as post nasal drip, or PND. This post nasal drip means the patient will tell you that, doctor, I am having a constant desire to uh, clean my throat. So that is known as post nasal drip. And runny nose, that is known as rhinorrhea. And there will be a thick yellow and greenish mucus. And earache, earache if the patient is having uh, sphenoidal sinusitis or maxillary sinusitis, the patient will develop earache. And halitosis and cough. And halitosis means foul smell from the mouth. And the patient is getting this foul smell because the infected mucus is dripping down into his throat. So that is why the patient is having halitosis and cough. So now the risk factors. The factors which are responsible to develop sinusitis. If a patient is having asthma, or if a person is a smoker, then these kind of persons they can develop sinusitis easily. And if a patient have already any nasal anatomical deformity, for example, nasal polyp or DNS. DNS means deviated nasal septum. So these kind of anatomical deformity, they can create a passage barrier inside the nose, and due to this passage barrier, there will be congestion feeling inside the nose and pressure headache. And these symptoms are developing because uh, the mucus coming from the sinuses, they won't be reach the nose. So that is why these symptoms are developing. Uh, and if a person is suffering from diseases like HIV/AIDS or cancer or tuberculosis, then he can also develop sinusitis, because these diseases, they decrease the immunity of the patient. And now the types of sinusitis. There are mainly three types of sinusitis: acute, chronic, and recurrent. Acute sinusitis means the symptoms, they last for a short duration, for about 2 to 3 weeks. And chronic sinusitis means the symptoms which last for more than 16 weeks. And I have seen patients who are having sinusitis more than for their symptoms last for 1 year, the whole year they are having the symptoms. And third type is recurrent sinusitis, means repeated attacks will be seen. And now the complications. If the symptoms of the sinusitis are left untreated, then the complications will be seen. There will be brain infection like meningitis, infection of the eyes like dacrocystitis, and other diseases like orbital cellulitis or orbital abscess. And cavernous sinus thrombosis. So these are the common complications if the um, sinus infection, if the sinusitis, if the symptoms of the sinusitis are left untreated. So now the diagnosis of the sinusitis. First, we will go for the nasal endoscopy. In nasal endoscopy, we have to put the endoscope tube inside the nose to find out where the blockage is. And after endoscopy, we should do CT scan and nasal swabs. Nasal swabs is done to find out the infection, the cause of the infection, if it is bacteria, virus, or any fungi. And allergy testing is done due to if the patient is having any uh, sensitivity to any allergy. So allergy testing is being done in these cases. So now the homeopathic management. If a patient is having sinusitis, we can prescribe him phosphorus. If there is aggravation during lightning or cloudy weather, so we can prescribe the patient phosphorus, and the patient must be chilly, and he should be tall and slender. Then only we can prescribe phosphorus. and belladonna if there is aggravation at 3 p.m. And Kali group is one of the most uh, prescribed and the best. These are the best remedies for respiratory infections. And Kali Bai is for infection uh, starting at the upper respiratory tract infection, and descending down to lower respiratory tract. So in these cases, we can prescribe the patient Kali bichromicum and arsenic album. Arsenic album, if there is not 3 a.m. or 3 p.m., then there is midnight aggravation. Midnight aggravation. Midnight means 10 p.m. to 12 a.m. Because at 1 a.m. it becomes morning. So it's not midnight. At 1 a.m. is not midnight. So midnight is between 10 p.m. to 12 a.m. If there is aggravation between 10 p.m. to 12 a.m., we can prescribe the patient arsenic album, and the patient must be fastidious enough. So this is all about sinusitis. Thank you.